Hey everyone, it's Dr. Nurse Tutor, and I am back as promised with another practice question. I am still staying within the respiratory system, so this is going to be another respiratory question, but it is pertaining to asthma. The question states, a patient diagnosed with status asthmaticus who was previously wheezing suddenly stops wheezing and continues to show signs of respiratory distress. Your assessment findings would indicate that A, the patient's condition is slowly improving. B, the patient is in imminent danger of respiratory collapse. C, the patient isn't as sick as you thought because he stopped wheezing. Or D, you need more information because wheezing isn't a sensitive indicator of asthma. Like I always say, go back to the question. What does the question say? Your question is your patient is diagnosed with status asthmaticus. If you know what status asthmaticus is a condition where your patient is having an asthma attack. And after using their bronchodilator, it does not help. The bronchodilator does not open up their airways. And you should know from status asthmaticus that is a medical emergency. If someone is having an asthma attack and they use their bronchodilator and that bronchodilator does not open their airways, this is a medical emergency because the wheezing is going to let you know that your patient is still breathing, right? They have bronchoconstriction, but they're still breathing. So it also says the patient suddenly stops wheezing and shows signs of respiratory distress. Anyone who's having an asthma attack, if they stop wheezing, we're in trouble. If they're wheezing, that lets me know that there's constriction, but there's still some passage of air. If someone has status asthmaticus and the treatment did not relieve the symptoms and they stop breathing and they are in respiratory distress, that is a medical emergency. That does not mean that because the wheezing stopped, the attack stopped. This means your patient is on the verge of respiratory distress, respiratory arrest. Now let's look at the answer choices. A says the condition is slowly improving. Based off of what I said, the conditions are not slowly improving. B says the patient is in imminent danger of respiratory collapse. I do like that. C says the patient isn't as sick as you thought because the patient stopped wheezing. Like I just said, anyone who's wheezing, if they stop wheezing, that means the airway, those bronchioles may be completely occluded. So that's not the answer. And then D says you need more information because wheezing isn't a sensitive indicator of asthma. That is not true. When someone is having an asthma attack, wheezing is usually what starts first. When that patient stops wheezing, like I said before, we are in danger, right? So this one should be the answer choice should be right on target. The patient's condition is not improving, so it's not A. C says the patient isn't as sick as you thought because they stopped wheezing. That is not true. And D says you need more information because wheezing isn't a sensitive indicator of asthma. All three of those answers are incorrect. They make absolutely no sense. The only answer that makes sense is that this patient is in imminent danger of respiratory collapse. Anyone who's wheezing, when they stop wheezing, we are in danger. Especially if this patient has status asthmaticus. That means the albuterol that they used did not work. They need to go to the emergency room as soon as possible. Do not mistake the fact, because you know that if someone uses their inhaler, they tend to stop wheezing, bronchioles will open up. With status asthmaticus, that is a different situation. That is a medical emergency. This patient uses their albuterol, the albuterol doesn't work, and the wheezing stops, but they still look like they're in respiratory distress, because if the wheezing stops and the bronchodilator was working, then the patient wouldn't look like they were in respiratory distress. But it's telling me that the wheezing stopped and the patient still looked like they were in respiratory distress. That is a medical emergency because this patient can suffer from respiratory collapse if we don't get them the help that they need. All right, so I hope this question helped. I will be back with more question choices, with more practice questions. And like I said before, if you guys have any questions or any areas that you're having difficulty with, don't be afraid to ask. But I will be back with more videos soon. All righty, bye-bye.